Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Okay. Now, prognostic factors of neuroblastoma. Fine. In the prognostic factors of neuroblastoma, right. Prognostic factors of neuroblastoma. If the stage of the tumor is stage 1, 2A, 2B and 4S, it is favorable prognosis. If the stage of the tumor is 3 and 4, it is unfavorable prognosis. If the age of the patient is less than 18 months, then it is favorable prognosis. If the age of the patient is more than 18 months, then it is unfavorable prognosis. If the evidence of squamous stroma and gangliocytic differentiation is present, it is favorable prognosis. Mitosis karyocytosis index is less than 200 by 5,000 per 5,000 cells. If the mitosis karyorexis index is less than 200 per 5,000 cells, then it is favorable prognosis. If it is more than 200 per 5,000 cells, then it is unfavorable prognosis. If DNA diploidy shows hyperdiploid or near triploid state, then it is favorable prognosis. If DNA ploidy is near diploid, then it is unfavorable prognosis. If NMYC is not amplified, it is favorable prognosis. If NMYC is amplified, then it is unfavorable prognosis. If chromosome 17q gain is present, then it is unfavorable prognosis. If chromosome 1p loss if chromosome 17q gain, chromosome 1p loss or chromosome 11q loss are present, then it is unfavorable prognosis. If TRKA expression is present, it is favorable prognosis. If TRKB expression is present, then it is unfavorable prognosis. Telomerase expression, if it is highly expressed, then it is unfavorable prognosis.
thank you and thank you for watching.